Most people think diabetes starts the moment a doctor hands you a lab result. But long before that blood test comes back, the biological damage has been compounding inside you for years. Right now, over 8 million Americans are walking around with this condition and have absolutely no idea. They experience the physical warning signs every single day, but they write them off as a normal part of getting older. Take a look at this map of the human vascular system. Notice the sheer distance from the heart all the way down to the toes. Your body has an early warning alarm for high blood sugar at the furthest point of this network, your feet. As the longest delivery route, they are the hardest place to pump blood to, and the first to show distress when that system starts to fail. Brushing off chronic foot discomfort means you are actively ignoring a biological fire alarm that is already ringing inside the house. The first system to take a hit is your nervous system. When blood sugar stays consistently high, it acts like a slow drip acid inside your body. It specifically targets your nerve endings, causing a condition doctors call peripheral neuropathy. This cross-section illustrates exactly how that damage happens. Think of your nerves like electrical wires. Excess glucose eats through the protective plastic coating of that wiring, exposing the sparking, erratic core, and causing the signals traveling back to your brain to become severely degraded. Those degraded, fuzzy signals manifest in your feet as tingling and numbness. And as those internal wires become completely exposed, they begin triggering false alarms. Your brain receives intense heat or pain messages when nothing is touching you, causing your soles to feel like they're burning, or sending stabbing, electric shocks through your feet at night. This nerve death destroys the autonomic nerves, the precise pathways that control automatic functions like regulating your skin's moisture. The sweat glands in your feet simply stop working, leading to chronically dry, deeply cracked heels that no amount of moisturizing lotion will fix. These intense pains and deep, bleeding cracks signal a systemic communication breakdown between your brain and your lower extremities. The second biological failure happens in your vascular system. Years of excess glucose physically stiffen and narrow your blood vessels, effectively choking off the oxygen delivery route to the lower half of your body. With that supply chain broken, warm blood can no longer reach your extremities. This creates a severe chilling effect, chronically cold feet that persist regardless of the summer heat or how many heavy blankets you pull over yourself. Look at this clinical illustration of the lower leg. When the tissue is severely starved of fresh, oxygenated blood, it visibly shows its distress. Notice this deep reddish-blue gradient settling around the ankles. That is a clear visual marker of oxygen deprivation. When blood flow becomes this restricted, your body enters a state of biological triage. It abandons non-essential functions to survive, which manifests as a complete loss of hair on the lower legs and toes. Chronically cold feet, unusual skin discoloration, and sudden hair loss provide visible external proof that your internal supply chain is collapsing. The final system failure happens within your kidneys and immune system. Chronic high blood sugar damages the tiny filters in your kidneys, destroying their ability to process fluids and waste. When that filtration plant backs up, gravity pulls the excess unfiltered fluid downward. This causes persistent, deep swelling in your ankles and feet, creating a condition known as pitting edema, where pressing the skin leaves a lingering indentation. At the same time, those narrowed, stiffened blood vessels are heavily restricting your immune system. If you get a minor scratch, the white blood cells and healing nutrients you need simply cannot travel through the blocked pipes to reach the injury. This leads to the most critical warning sign of all: wounds that simply will not heal. Starved of healing cells, a tiny blister from a tight shoe becomes a permanently open door for infection, and a leading cause of lower limb amputation in the United States. A swollen foot carrying a minor, unhealed scratch indicates the body has entirely lost its ability to clean and repair itself. Recognizing these 9 signs represents the first step in reversing the damage. You need a 30-second daily habit. Every single night before bed, sit down and physically inspect your feet. Look between toes for hidden wounds. Check your heels for cracks, and look for unusual color changes. Next, you have to force blood back into these failing networks. A purposeful 20 to 30-minute brisk walk every single day pushes oxygen deep into your lower extremities and strengthens those blood vessel walls. If you recognize any of the signs we've covered today, schedule a fasting blood glucose test. It costs about $12 at a certified lab. Do not put it off until next month. Get it done this week. You've worked hard for your independence and your mobility. High blood sugar is manageable, but only if you catch it. Don't let it take away the life you've built simply because you didn't know the body was screaming for help.